6 officials from the Department of Health and Human Services have just arrived on the island to provide the much-needed services at the Healthcare Corporation.
Department of Health and Human Services began their 90-day service period this morning. Officials met with CHC Chief Executive Juan Babauta and Acting Governor Eloy Enos. Each official will be working in a different area of the hospital. The United States government is providing Deputy Chief Executive Officer Newton Kendig, Nurse Manager Lisa Hagen, Safety Officer and Physician Dr. Sylvia Cohen, Pharmacist Manager Kathleen Dotson, Clinical Lab Manager Daniel Hasselgesser, and Medical Technologist Lane Vouse. All have extensive resumes and have worked in many hospitals throughout the United States. Chief Executive Officer Newton Kendig says they will send more personnel to help assist in their efforts.
We're going to be adding additional members to the team. I mentioned earlier in the briefing that one of the reasons we didn't send the full team, we wanted to assess what the needs were here so that we could best meet them. And so that will be one of the priorities for the first several days here, is to meet with the leadership at the hospital and to assess what other healthcare professionals can best help the hospital and the people of Saipan.
Newton adds altogether the team will consist of 10 or 11 officers. Newton says the team will provide technical assistance for all the issues that were identified in the CMS report and audit. The hospital is still facing critical deficiencies.
It's really going to be collaborative. Okay. Some of our officers are going to be in supervisory capacities, and some of them will be doing frontline patient care. We're going to be looking at laboratory services, pharmacy services, nursing services, and all of the issues that were identified.
Babauta says he's relieved that the hospital will receive assistance.
They are preeminent in their fields, and so I am just so glad that they're here and to help us put together our laboratory services.
Newton says he reports the progress to his commanders in Washington. The cost for these services is funded by the Department of Interior, Department of Health and Human Services, and the Commonwealth.